Good morning. All along, I had highlighted how AI can improve clinical outcomes in diagnostics, in prognostication, etc. But this short video presentation is to emphasize how AI can be a real-time teaching companion. In psychomotor skill training for resident, a teacher in the 1:1 ratio and available 24/7 will be ideal. But that is not possible in the most imagined quote unquote utopian settings. Now, can AI fill this teaching gap? Let us have a look. So, this is your true cut biopsy needle here, and I'm placing it on the lump. Now, this is a still picture. Now, what is happening? AI can actively transform biopsy techniques and provide real-time guidance during tissue sampling. It can tell you whether the tissue retrieved is accurate or adequate. It can assist in pre-screening and grading, saying this tissue is grade 1 or this tissue is very bad grade, don't send it, repeat. And finally, now less invasive alternatives have come to tissue sampling, which is AI enabled. So there is not only diagnostic precision, you can reduce error in the procedure, reduce error in the interpretation, and actually you can optimize patient management in clinical practice. Why I'm telling you this? Very many times in my experience, even I've done it, when biopsies, tissue samplings, juniors are doing without supervision, most of the time it will come inadequate and patient is again subjected to another biopsy. Now, can AI be in some sort support the surgical trainee and saying, no, this biopsy is, the technique is not right or the biopsy specimen is not adequate. The trainee can do corrective measures. Now, this is not only with trainee. Most senior surgeons will also be using some sort of AI at some sort point of their career when they are doing very complex procedures or complex therapeutic procedures, or even when they are using imaging techniques. Let's have a look. So what did I do? I just took this snapshot. This is a video, but I can't put it into an AI. Now, this is a true cut image. Can you critique? So, what it has told, the gun is held firm and with the dominant hand. It is able to look at these things, which is very important. This is just ChatGPT, the free version. Now, it has also told you how can you improve. They are saying that the angle can be better. Naturally, when the angles are better, the ergonomics will be better and your tissue sampling will be better. So, and then gun stability, maintain the current two-handed grip. Now, not only that, it is also looking at the periphery. I did not ask anything else. I only wanted the technique. It has told that there are some issues with sterility. There are some issues with the gloves. Now, all these things are very important to keep you grounded to the right track. So whenever you ask AI, it will tell you the what is going on and what can be done better also. Now, don't read too much into this AI and start criticizing why we are not wearing gloves, why there is no shield on the patient and things like that. This is in a government hospital. We are trying to work with the resources that is available. The point here is that you get the biopsy and don't concentrate too much on the periphery that the AI has given. So this is responsible way of using the AI. This is very, very important, and not get swayed with the periphery. So not only you also must be aware of the environment. Your AI is aware of the environment and is throwing up everything that is available. but you must be aware what is your objective and what is your environment. So now after taking the biopsy, I marked this. This is FNAC, forget it. I have marked it so that the AI can look at it particularly. It will not go looking for all over the place. Naturally, if you put garbage into your AI, you're going to get a beautifully structured garbage out of your AI. So see the image of the marked red box. True cut of a breast lump. Is it adequate? You see this noodle-like structure, whether it is adequate. So it is having a visual review and it is also thanking that we have marked it. So it has told a whole lot of things that it is reasonably adequate. Based on this image, yes, the specimen is potentially adequate. Now it has given you this is a still picture, but if you are going to have an real-time AA, that time itself will tell you this score is adequate so that you need not do 2-3 passes. Or sometimes it can suggest no one core. Actually, there are 2 cores here, but I have marked only 1 core. It can even suggest please do more cores if you want to do a receptor study. Now it has gone one step behind and told label clearly. See, it is taking care of patient safety. Of course, mix up in biopsy reports. It's also a medical error. It is warning you there because it knows that the next fallout will be the labeling errors. Apart from doing a perfect procedure, you can totally tank by doing the logistics badly. Send promptly. Don't let it hang around in your room. Now you can ask, it's going one step further and it is saying you can always ask for receptor studies. Later it is reinforcing the receptor study. Now this was very brief about how AI can help the surgical trainee. That is why you must learn at least the basics of machine learning, or at least the basics of what exactly is AI, how it's going to help me, and when must I not get swayed by AI. Like I told you, it was talking about the sterility in that environment. Now, as I told you, we are working in a resource crunched environment. So it is very difficult to fix up downstream problems that the AI will spot in a given still picture. So at that point of time, you must know when not to take AI word by word and to act on it. Your objective was to make sure that you're taking the right biopsy, you're taking the right amount of tissue with the right technique. That is why you employed the AI in that particular image. So thank you very much. Please keep following this space, and I will stress how students need to know about AI. Thank you.